What should women and men of childbearing years know about preserving fertility prior to transplant?
First off, the average age for diagnosis of myeloma is about 65 to 69 years old. For women, this will be a very selective group of patients, very small amount, right? It's a very difficult question from my end to tell patients exactly what to do, right? I think this is more of a personal option, right? But there are many things that needs to be considered. Women who are able to collect eggs for thinking about subsequent pregnancy need to balance what are the potential risks of this pregnancy. Because we know nowadays that these young patients are going to get induction therapy, they are going to get a transplant, they are going to now go to maintenance therapy, right? There is no medications on the maintenance algorithm that is compatible with a pregnancy. We know Revlimid or this type of medication like IMIX can produce phocomelia, like some malformation in the fetuses. There's a category D, so it's a must no. Medications like daratumumab, bortezomib, carfilzomib, they are a category C, meaning that there is like evidence in animal models that it could be harmful for the baby. So if female patient of childbearing age wants to have family after the initial treatments, then it potentially needs to be planned very well. Fertility preservation measures should take place, right? So this means that a specialist in fertility preservation should be consulted. Some of the academic centers have this capability, otherwise they need to look outside from there. But most clinics, especially myeloma clinics, will have some resources for those patients. After that, then the patient needs to understand as well what is the risk of, for example, stopping maintenance therapy, right? Especially if they are a high-risk myeloma patient, right? So they need to also understand that, right? Because even though a pregnancy may go to an end, there is also no way of like predicting on high-risk patients, for how long their disease are going to be under control. They could run into issues mid-pregnancy, right? So I think it's I understand why patients who kind of want an answer and may want to do it, but at the same time, I think it's a very difficult question to give you a straight answer, right? So there are many things involved. So it has to go from your disease risk, for the type of therapy that you're going to receive, having off therapy time, right? And yes, as you asked, one of the questions was like, what is the chances of going to menopause, right? High chances, right? And even though some few patients may recover the ovarian function and get pregnant, right, is less likely because this is a really high dose of chemotherapy, right? But there are certain strategies that may prevent, right? So there are medications that can be given to sort of like put the ovarian into a like hibernation status, right? So that it may then wake up down the road, right? Or they may be able to collect eggs, right? And separate egg and then do in vitro fertilization, right? Those things could happen, right? But I think there are many things that need to be taken into consideration. There are other things that people may also consider, right? Like a surrogate for pregnancy, right? So they collect their eggs before, and then the eggs could be, once they are processed, they could be implanted into a surrogate. But there are many steps and complicated scenarios. That's for females, right? It's a more complicated ordeal, right? They are the ones who are going to have the baby on them, right? Now, for male, it's a little bit more straightforward, a little bit simple, I would say, right? So sperm banking is much easier. There is a sperm banking that can happen before transplant. Of course, also allowing for some washout period from medications like, for example, like Revlimid. And then the right person for this will be also a fertility specialist, usually, a group of urologists and other people who will help the patient, for the sperm banking and, then subsequently, how are they going to be inseminated. It's a very not very straightforward topic, right? We're still talking about an incurable disease, right? So there are many things that the patients will have to consider, and then, discuss with the doctors, find the right help, right, if they want to go through, and then plan accordingly, right, in multiple steps.